everyone. My name is Anika, aka Neek the Goddess. Hi, I hope everyone is doing well. The purpose of this vlog is that I was searching YouTube for like inspirational videos for gastric sleeve patients who has gotten pregnant after 35. If you don't know, I am currently 18 weeks pregnant with my second child. I successfully gave birth to a beautiful, healthy boy in 2011 through induction. However, there are more risks now than there was, let's say, when I had him because of my age. And then the second thing is because of my situation surrounding my gastric sleeve surgery. I lost a total of 177 pounds total. Yay, me. And before that time, I was told that I would never have kids. I mean, for 17 years, I was told this. And then all of a sudden, on Valentine's night 2011, I got pregnant with my son. And for those people out there that are saying that they will never get pregnant or feeling down because they have not gotten pregnant, there is hope. There is hope, 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 hope. So, I just want to discuss with you how I was feeling during my first trimester. I'm currently well into my second, and I really thank the Most High for that because it really caught me off guard about this pregnancy. Wasn't expecting, wasn't trying, or anything. It started out, I actually was cleaning the house one day, and for some odd reason, normally when I use like cleaning products, more specifically when I use the product Fabulosa. I don't know if a lot of people have ever heard of that, but I love to buy it. It smells really nice. Some people actually put it on a stove with some water and boil it and let the aroma just, saturate the house. But this particular day, I was using that cleaning item, and I started gagging. And I was like, wait a minute, I love the smell of this stuff, so why am I gagging? And then a couple of days after that, my breasts started irritating me. Like, this might be too much information for some people, but it was, if you have been pregnant before, you know what I'm talking about. Your breast feels like, they itch, the nipples were sore, and I was like, wait a minute. So what I did, I actually went to the store, and because I live a ways away from like CVS, so I saw that they had a Dollar General up the street, so I stopped there. And I have heard of people using the cheap pregnancy test, but I was like, maybe they don't work. But this particular day, I was like, let me just try and see. So I actually purchased 2 of them to make sure. And when I purchased them, I was like, okay, well, I'm not going to take these right now. I'm going to wait a couple of days. And this was back in August. My conception date was actually the night of July 11th. Don't ask me how I remember that. I remember both the dates for my children when I conceived them. This is something that I keep up with. So I actually waited like 3 days. I took the test, And the first one came back positive. And I was like, no way, no way. And then I took the other one. And I was like, oh my God. Like, y'all, you do not know how I was feeling. I was like, I'm going to be a mom to a whole nother person. Like, what am I going to do? So I called my doctor and I actually asked her, I was like, well, can I make an appointment to come in because I don't believe that I'm pregnant. And she was like, okay, well, what did the test say? And I'm like, well, the test said that it was positive. I said, but I just want to confirm because I use, the ones at the dollar store. And she was like, okay. So made an appointment for like August 2nd or 3rd. And I came in and she confirmed that I was pregnant. And I was like, oh, I was just sitting there. And she said, don't worry, you got this. And I was like, yeah, I know, but it's the first shock, You really don't know how you're going to feel, until you have the baby. When you have that baby in your arms, and the moment after you give birth, up until that time is pure speculation. Of course, you're going to love them and all of that, but wow. So that's all I was thinking about, was sitting on that table in the doctor's office. And during my first trimester, I can honestly tell you that I had massive cravings that I wasn't even craving before. Like, I like butter pecan ice cream, so that was one of the things that I love to eat and started eating more of. And I mean, when I say more of, I would 3-4 o'clock in the morning I would make a bowl of butter pecan ice cream, and I started back eating Lay's plain potato chips with hot sauce, believe it or not. And it started from there because I love to eat spicy stuff, but not to this magnitude. With my son, I didn't care for all that spicy stuff. But with this child, yes, spicy stuff. So anything from eating hot sauce to just eating jalapeno peppers with nothing, that would be me. Spicy foods are the thing. So I knew that possibly I wasn't going to, but have a girl or a boy, I really didn't know because I had some of the same cravings that I had with my son, and then some were new. This baby will not allow me to eat a lot of sweets. So I have to actually eat food. Where to with my son, I could eat, sweets. But with this one, no. We want mashed potatoes. We want fried chicken. We want cube steaks and gravy. We want food. So that is a total. When they say that every pregnancy is different, they're not lying. But as far as being high risk, we're gonna jump back onto that. During my first prenatal appointment, I didn't have until 12 weeks, and that was because the OB was booked that I chose, and I didn't want to stray from using them, so I actually waited. And during that time, we actually performed tests. They got to look at well, after the test, they actually discussed with me, certain things, and we actually listened to the baby's heartbeat. So what I'm going to do, I'm going to play it for you so that everyone can hear. I would love to share this moment with everyone. And this was actually uh, September 22nd was my first prenatal appointment, um, where I got to listen to the baby's heartbeat. Here it goes. I hope you can hear that.
Sounds good. 145, 150. Sounds perfect. Nice and strong.
Did you hear it? So the baby is alive and kicking. um, I got to see the baby on ultrasound. I had to be rushed into the ER because I felt a really sharp pain in my uterus, and I was afraid that I was going to have a miscarriage. So a week before that, I ended up going to the ER, and they hooked me up to the machine, and I had ultrasound done, and to my surprise, the baby was doing wonderful. Um, I had ate um, some sour gummy worms before I went in, and on ultrasound, you could tell that I had something because the baby was doing flips, and you could just see the little toes, and the baby was kicking, and I was like, oh wow. So, at that point I was like, oh wow, this baby here is full of fire. Like, and it's funny because the baby will be born in April. Well, the due date is March 29th of 2018. But I'm suspecting that the baby will come the weekend of Easter, either if not that weekend, a couple of days after, so like the 3rd or the 4th of April. But we will see. And it was such a sight to see. So when I went in for my first prenatal appointment, I was able to discuss these things with the OBGYN. And because I'm high risk, they recommended that in addition to them, that I see a maternal fetal specialist. And I had no clue. I had never heard of a maternal fetal specialist. And what they actually do is they just have extra specialized training. They are OBGYNs, but they have additional training beyond what is required, and they handle high risk pregnancies. So I have to go see the regular OB once a month. I also have to see the maternal fetal specialist in addition to that. But during my prenatal visit, they actually took blood, and some of the things that they are screening for. I actually kept the pamphlets so that I could share them with everyone. The first test was cystic fibrosis. And if you've never heard of it, I'm going to show it. It's a chronic life-shortening inherited disease of children and young adults. So I felt this was very important because I didn't want anything to be genetically wrong with the baby. And they discuss with me, the risks involved. So because of my age and the fact that I am a gastric sleeve patient, so I took that into consideration. The second test they actually performed is called Fragile X syndrome. And if you can see that, it's the most common inherited cause of mental retardation. So I wanted to definitely make sure that the baby that I had was not, didn't come out mentally retarded. And no offense to anyone else whose child has, because babies, we just get pregnant with them. You know, the Lord determines their paths, and if they do come out, there's no reason not to show them love. But in my case, I just wanted to make sure everything was right with the baby that I'm carrying. The third test is called spinal muscular atrophy. I hope I said that right. It's the most common inherited cause of early childhood death. And I definitely wanted to screen for this one because I didn't want any surprises, if that makes sense. The second one, the fourth test is called is a sequential screen. It provides early information. Okay, there we go. It provides early information and high detection rates for birth defects. So in addition to the other three tests, my baby was tested for that. And the last test is called AFP4, and it's the best second trimester screen. Sorry, can't see. The best second trimester screen for birth defects. So because I was 12 weeks, they went ahead and screened me for this ahead of time. And because I had these tests done, they were able to tell me the sex of the baby. So I'm having a girl. And to let everyone know, the screens came back perfect. The baby is healthy. That made me extremely happy. And this is what I shared with Facebook. And as you can see, baby girl Adia, and that is her chosen name, will be born the end of March, which is March 29th. And she's going to be an Easter baby. Bless her heart. And for those who want to know what that name means, it's actually Hebrew, and it means God's treasure, and which she really is a treasure, just like her mom. I'm just kidding. But during my prenatal appointment, they also gave me a whole bunch of samples of prenatal vitamins, and I started taking them. I was already taking some before, in which, because I'm high risk already, I receive a B12 shot once a month to level out my iron. And if you haven't had gastric sleeve, you wouldn't know. But we have to keep our levels stabilized. Otherwise, we can experience fatigue, and we could start having heart palpitations and anxiety and panic attacks. So we have to make sure our hair can actually fall out as well, which is the reason why I started taking B12 shots in the beginning. But anyway, they actually gave me a bag full of prenatal vitamins to try. And one of the ones is called Concept DHA. Can you see that? Okay. Concept DHA. And with these, I actually like these. They work pretty well. They did not upset my stomach. I prefer liquid tabs. So with these, if I'm not mistaken, because I took one set, they are liquid, and it works very well with my stomach. The second type of prenatal vitamin they gave me is called Citrinatal Assure. Can you see that? Okay. And with these, they actually give you a prenatal vitamin and a stool softener to take every single day. It helps with people who are not gastric sleeve patients, to help you go to the bathroom. But if you have had weight loss surgery, you absolutely know that it's easy for us to go. Like, it is not hard for us to go at all. And after 3 days, after 3 days of taking these, I had to stop because it had me feeling like I was experiencing dumping syndrome. And with dumping syndrome, it's just like diarrhea, but like I had to stop. So, but otherwise, the prenatal vitamin itself is great. I enjoy taking those. It didn't upset my stomach either, and it was a soft gel as well, so that was pretty good. The third prenatal vitamin that they gave me, the sample is called Prenate AM, and this prenatal vitamin contains B vitamins and ginger. I have not started taking these yet, but I'm anxious to try them. Only because it contains ginger and B vitamins, in which, as a pregnant woman, we need to make sure that we have a lot of B vitamin and iron in our system for ourselves as well as the baby. The last prenatal vitamin that they gave me is called Prenate Pixie. And I like these also. So I actually took all of these. These were the first ones that I took. And it also is a tiny soft gel. So, and you can kind of see a sample of what the gel looks like right there. And that's the actual size. It's lactose free as well as gluten free. So it really helped my tummy out. I mean, because I am lactose intolerant, and I don't tolerate a lot of gluten. So, and I try to stay away from that. So, very good job. I actually love these the most out of all of the vitamins that I take. So, with that being said, I'm going to show you what my bump looks like right now. As of today, I am 18 weeks. But because I am a gastric sleeve patient, I wasn't able to get my stomach to be totally flat. So my stomach might look a little bit, to some, but you could kind of see the form of it. And she's perfectly in. She's in there. So I will show you what it looks like. It's getting round, which I appreciate. And that's it from the front. You can kind of see it sticking out here, which is lovely. That lets me know she's growing, and I appreciate that. So, with that being said, if you would like more information or would just like to talk to me about high-risk pregnancies and what I experienced during my first pregnancy versus what I experienced now, you can email me. See the email address at neekthegoddess@gmail.com. I welcome any questions, suggestions, whatever. I will reply. If you leave a comment, I will reply to that as well. I thank you for watching. You can like, share, as well as subscribe to my channel. I will try to keep you updated on my progress, because I found that, it's very imperative that we share our experiences with everyone else, because it's probably someone out there in my situation that doesn't have anyone to talk to, that, either has tried to get pregnant, is pregnant and they're 35 years or older. I'm currently 38. Didn't think I would be having children this late in life. But you know what? This is what the Lord wants, so I'm going to roll with it. And I thank you for watching, and until next time, take care. Bye-bye.